Hello, my name is Angelica Orozco, and I'm here to talk to you about the UpToDate tool. It's a research tool with up-to-date information. This is Dr. Burton Bud Rose. He begins UpToDate in his basement in 1986 after being refused by his publisher. He had written many books in nephrology since that was his specialty, and the publisher did not think that having compiled information up to date with peer-reviewed colleagues would be a good idea at the time. So Bud Rose decided to approach his colleague Jim Curtis in Brigham and Women's, and they decided to work on this together, and they developed UpToDate in 1991. Here you see the main screen on the right where it says what's new. They usually have something new and interesting as far as their up-to-date research from various specialties. Here you can see it's NICU. Endotracheal suctioning doesn't benefit non-vigorous neonates. And so you can have a subscription as a medical professional or through the hospital that you work with. Here you see the infographics. It's staying up to date with different tabs: global impact, up-to-date medical knowledge, decisions, and improving care. It's peer-reviewed. There's evidence-based. There's also 2 printouts or emails that you can have available for your patients. One of them is very basic, 5th grade level, and the other one is beyond basic. It's considered 10th grade level or above. And it can be, as I said, emailed or printed out for peers or patients. And it's updated with every single login. So every time you log in, you get the most up-to-date information. Here, there's more reasons to use the tool. You can access the journals anywhere in the world. They have a donation fund right now for helping in a global level to various countries that would otherwise not be able to have this research available. According to a 3-year study by Harvard, they say that there's shorter hospital stays, decreased mortality rate by as much as 11,500 lives that have been saved due to this amazing tool. So we're going to see this in action. I typed in pyelonephritis with recurrent urinary tract infection in women. And so here you see the very basic tabs for a patient that you can give out. You would just click on the tab and then it would give you more information. And this is what you would see. For example, what's urinary tract infection, or what is the urinary tract? And it'll tell you what it is, what it looks like, how it works in a very basic way, as well as what your symptoms would be if that's exactly what you have. Here is for the medical professional. You see there's different tabs here for references, tables, related topics. Here's the introduction for a recurrent urinary tract infection. It gives you information about that. And then here's the epidemiology, pathogenesis, also differentiating between reinfection versus relapse. I find that would be really useful as a new grad in the F&P program, just because it's a very good tool and it's a good resource. Here you see the prophylaxis of medication for a urinary tract infection. Here is antimicrobial resistance. So you have different medications. Those green tabs you can actually click on and you'll get more information from different studies, different breakthroughs. There's also other compounds here that you could use potentially with studies to back up their information. Here, urological evaluation. So this would be a test that you could perform, different strategies. Again, more prophylaxis, special considerations, for example, with medication and renal insufficiency. In this case, there's also a new vaccine that was showing some promise for UTIs, and then other immunostimulants. Here you see just a simple picture that I was able to download from Medline: kidneys, ureter, bladder, and urethra. The pros and cons of this program. The pros, I would have to say, are up-to-date evidence, simplistic analysis of diagnosis with explanations, navigates to the lab test to determine different diagnoses. It'll suggest a differential diagnosis, and in that tab, you'd be able to click on it and it'll give you more information. There's infographics, there's references to their studies, there's medication suggestions, there's special considerations. There's also another tab for drug-to-drug interaction. The cons, I would say that it seems kind of dry. It would need more creative visualization, something a little bit more colorful, I think would be nice. Also, I think the biggest one is probably the cost. It's very, very expensive to have it. So luckily, most hospitals do carry the subscription, but if they don't, it can get pricey. They also have a subscription for patients. They can pay monthly or yearly, and it's also pricey, but again, it's worth it if you have a lot of medical conditions, I would imagine. Here are my references, UpToDate and Medline. Thank you for watching. If you have any questions, please feel free to contact me. Thank you.